Whether it is new monthly premiums, new deductibles, new copays, or more, one of the constants of Medicare Part D prescription drug coverage is that it changes every year. With that being said, the changes that we see coming up in 2025 due to the Inflation Reduction Act may cause the biggest changes to Part D in several years. In this video, we will break down the changes that you need to know about, what their impacts might be for you, and what we think the future of Medicare Part D prescription drug coverage might look like. First, my name is Cameron Giardini, and I help operate our independent Medicare-focused insurance agency, Giardini Medicare. Since we can only cover so much in each video, if you do want to have your personal situation discussed with one of our brokers or another agency we trust, you can start that process by going to doineedmedicare.com or our website, gmedicareteam.com, and then there you can click the Schedule a Free Call button. As a reminder, Medicare Part D coverage, it is separate from original Medicare, and it provides coverage for outpatient medications that you fill at retail pharmacies. Part D coverage often comes in the form of a standalone Part D plan, which you would purchase in addition to a Medicare supplement plan, or you can have Part D coverage as part of a bundled alternative to original Medicare in the form of a Medicare Advantage plan. Both standalone Part D plans and Medicare Advantage plans are sold by private insurance companies, so keep that in mind as we talk throughout this video. Now, this video, it is going to strictly focus on the changes to the standalone Part D plans, but make sure you subscribe to our channel so that you are notified of our next video that will talk about these different Part D changes and their impacts on those bundled plans like Medicare Advantage plans. The Inflation Reduction Act was originally signed into law in 2022, and back then we did do a video that was highlighting and overviewing those changes. Some of the changes that have already been implemented from this law include a $35 cap on covered insulins, no cost for vaccines covered under Part D, no cost sharing for medications if you reach the Part D catastrophic phase of coverage, and expanded eligibility for the low income subsidy, which is also known as extra help. Now we'll move to the future and we'll look at the major changes that are going to take place next year. First, the structure of Part D coverage will be changing. What does this actually mean though? Currently, there are 4 phases of prescription drug coverage, which include the deductible, the initial coverage phase, then the coverage gap, which is often famously known as the donut hole, and then finally the final phase, which is catastrophic coverage. Now, the first relatively small change to note is that in 2025, the Part D deductible, or the maximum Part D deductible, will be increasing from $545 this year in 2024 up to $590 in 2025. In addition to that, in 2025, the donut hole will finally be completely eliminated. This is going to leave just 3 phases of Part D coverage. You may have already seen headlines in the past saying the donut hole is closing, but nevertheless, it did remain intact and it negatively impacted many people, but now in 2025, it will be officially gone. However, perhaps the most impactful and important change going into 2025 is the new $2,000 spending cap for prescription medications covered by your Part D plan. In 2025, you, the consumer watching this, you will only spend up to $2,000 out of pocket for prescription medications covered by your Part D plan if it's on the plan's formulary. Now, if you reach this cap, you will reach the final phase of coverage for Part D, which again is catastrophic coverage. And then you will not be responsible for any more costs for covered medications for the remainder of the year. Let's compare this to right now in 2024 when, according to the Kaiser Family Foundation, they report that most consumers taking a normal mix of generic and brand name medications, they would have to spend about $3,300 up to $3,800 out of pocket to reach that same catastrophic coverage this year. However, currently, some consumers with expensive generic medications could spend all the way up to $8,000 in 2024. And if we look back not long ago, just last year in 2023, it was not uncommon for people with very expensive medications to spend more than $10,000 per year out of their own pocket, even with Part D coverage that covered their medications. Now, something that is really easy to get lost in this Part D structure change, aside from changing the deductible, aside from the donut hole elimination, and aside from the $2,000 cap, is the fact that the burden of the majority of the costs will be shifting from the federal government and Medicare to the insurance companies that offer these Part D plans. This can best be seen by this helpful but realistically somewhat confusing graph published by KFF. Without going too much into the weeds, we want to focus on the top part of this graph, which compares covers the 2024 and the 2025 Part D catastrophic phase of coverage. In 2024, when a person with Part D coverage reaches the catastrophic phase of coverage, the government is then responsible for paying 80% of their medication costs for the remainder of the year, while the Part D insurance company is only responsible for 20% of those medication costs currently. This is important because according to the Medicare Payment Advisory Commission, which we will shorten to MedPAC, they recently reported that as of 2022, the spending in the catastrophic phase of coverage cost the Medicare program $56.8 billion, and it was the fastest growing part of the overall Part D spending. Now, if we compare the structure to 2025, you can see that Medicare is essentially going to swap financial responsibility with these Part D insurance companies. In the catastrophic phase of coverage in 2025, Part D plans will now be responsible for 60% of medication costs, while Medicare is responsible for 20%, and drug manufacturers must pay the remaining 20%. For an easier example, if we look at 2024 versus 2025 using a $1,000 medication, this would mean in the final phase of Part D coverage in 2024, Medicare would pay $800 and Part D plans would pay $200 for this medication. In 2025, due to the changes we talked about, the Part D plan would then pay $600, Medicare $200, and the manufacturer paying $200. Frankly, although drastic, this change in payment responsibility shifting from the government to the Part D plans, it was needed in some part, at least in our opinion. This chart from drugchannels.net, it shows that over the last several years, financial liability has greatly shifted from Part D plans and insurance companies to Medicare, aka you, the taxpayers. This is also seen in this graph from the Kaiser Family Foundation. This has created very little incentive for Part D plans to promote lower cost medications, and it is one of the factors leading to the overall increase in Medicare Part D spending for the program as a whole. Okay, going back to the $2,000 Part D cap that is coming up, I think we can all agree that potentially spending $2,000 for costly medications, although clearly better than the past, it can still be a financial shock if you have to pay all of these costs upfront at the pharmacy at one time. So for this reason, in addition to the spending cap, there will be a brand new Medicare prescription payment plan to help beneficiaries with high medication costs spread their costs out by paying monthly payments throughout the year instead of being responsible for large lump sum payments right away at the pharmacy. Even for us as brokers, the math behind this new payment structure, it can get really complicated quickly based on when you choose to enroll in it and which medications you're taking and when you're taking those medications. You can see this example published by Medicare for someone who opts into the program and pays for a low-cost generic medication in January and then goes to the pharmacy in February to fill a much more expensive medication. We will link to this document that includes many more examples about how this payment plan may work, but just know that the final guidelines for this payment plan have not been released as of recording this video, but should be released soon sometime this summer, so of course stay tuned. For now, here are additional things that we know about this payment plan, and we will of course link to these sources down in the description below this video. Number one, this is a voluntary program, but it is available to all Medicare beneficiaries with prescription drug coverage. This includes Part D and, like we said, Medicare Advantage. Number two, opting into this program, it can begin October 15th, 2024, and it requires Part D plans process those enrollments within 10 days. You can also join this program anytime during 2025, and if you enroll in 2025, that enrollment request is required to be processed within 24 hours instead. Number three, Medicare requires that Part D plans notify pharmacies if one of their enrollees has a cost sharing for a covered medication of $600 or more. And then in this case, the pharmacy would provide the beneficiary with a standardized likely to benefit notice informing that beneficiary how they may benefit from this monthly payment plan. Medicare estimates that this may apply to just over 1 million enrollees, as you can see in their report. Last but not least, Part D plans cannot terminate members from their actual Part D coverage for non-payment of the monthly prescription payment plan. Now, Part D plans, they can terminate you from the payment plan itself after a 2-month grace period of non-payment, but that is not the same as actually terminating you from your Part D plan in this case. Keep in mind, they can still terminate you from your Part D plan if you don't pay your plan's premium, just like in the past, and unpaid amounts from that actual payment plan, they will be treated as medical information under the Fair Credit Reporting Act, and they are subject to collections. Overall, in more simple terms, this payment plan is designed so that if you go to the pharmacy, and let's just say your medication costs you $1,000, instead of you paying those costs right away out of pocket, your insurance company will pay the $1,000 to the pharmacy on your behalf. Then your Part D plan would bill you in monthly installments for the $1,000 that you owe them, and those payments can't exceed a certain amount per month. As you can see, there are many moving parts to the changes coming to Part D coverage for 2025. We will use real-life examples and data to better show how these will directly impact you, the Medicare enrollee, watching this video. Whether you take no medications or dozens of expensive medications, these changes will matter to you, so please make sure to watch until the end. Let's first consider the new $2,000 Part D spending cap and the change in the Part D coverage structure. The overall impact of this out-of-pocket limit will depend on how many people actually reach the $2,000 spending cap in 2025, but for now, no one knows that number, not even the insurance companies. However, if we look at a study done by KFF, it shows that in 2021, there were roughly 1.5 million people that had out-of-pocket prescription costs of at least $2,000. Now, we did our own analysis using this data from KFF, and to save time, we will link to the document showing our math in the description below, but overall, if we assume that these 1.5 million people each have those same medication costs in 2024 and 2025, again, the same costs they had in 2021, you can see here 2021 versus 2024 versus 2025 for how much the consumer would be responsible for their out-of-pocket cost compared to the cost that the Part D insurance company is responsible for as well. You can see here that the cost to the insurance company greatly increase as costs for consumers decrease throughout the last few years. Again, this shows that even if members are taking the same medications as in the past, Part D insurance companies will be spending more out of pocket in 2025 for individuals with higher prescription drug costs. Now let's take a look at the different examples of how the financial responsibility will change from Medicare and the federal government to the insurance companies offering these Part D plans. To do this, we will look at a different KFF study that looked at individuals taking some of the most expensive Part D medications. In 2021, there were 115,686 people taking medications that you can see here on the screen, which range from retail cost of about $17,000 all the way to $23,000 when we look at these medications today on Medicare.gov. For our example, we will assume that they have the same retail price as Revlimid, which Medicare estimates at $20,367. Again, these are just estimates showing some of the math. Assuming these 115,000 people continue taking these exact same medications in 2024 and 2025, here's how much they would cost Medicare compared to Part D plans. This should not be too surprising since we already discussed Part D plans will be responsible for 60% of costs in the catastrophic phase of coverage in 2025 versus just 20% this year in 2024. Still, just for these 115,000 people, which are a very small percentage of overall Part D enrollment, insurance companies offering Part D plans, they would be responsible for approximately $17 billion in 2025 compared to $5.8 billion in 2024. And conversely, Medicare and the federal government would go from paying $21.5 billion in 2024 down to $5.5 billion in 2025. Although the new Part D structure and the $2,000 spending cap is going to get most of the headlines going into 2025, there are also additional impacts that the Medicare prescription payment plan will have on insurance companies. This new payment plan will almost certainly add to the administrative costs for Part D insurance companies. This may be in the form of sending extra communications to members about the new payment plan or figuring out how to communicate effectively with the pharmacies about this program. This may also result in increased hiring or increased training time for customer service reps that will be needed when this new plan inevitably causes chaos and confusion among Part D members, insurance companies, and even ourselves as brokers. Also, Part D plans, their administrative costs will almost certainly rise due to unsettled balances from the payment plan that members have not paid, because as you can see here, those are counted towards admin costs according to Medicare. Although I would like to be optimistic, I can easily see many consumers not fully paying back their prescription costs that they owed from the payment plan. Now, we don't expect you to care about the spending and the profits of these billion-dollar companies. Just know that when Part D plans submit their bids to Medicare in June of every year to determine their plan premiums that you will pay, the administrative costs are considered in the total cost to provide someone Part D coverage. So, increased administrative costs, they can directly lead to you, the consumer, paying higher Part D premiums in monthly payments. Quickly, before we wrap things up and give our thoughts about the Part D changes coming in the next year, let's briefly take a look at what the insurance companies themselves are saying. CVS/Aetna and WellCare are two insurance companies with the largest current standalone Part D enrollment numbers, so we will look at their opinions. The executive vice president and president at Aetna said during their Q1 earnings call with investors, the benefit has been enriched pretty significantly by the IRA, which is the Inflation Reduction Act, and secondly, the plan is on the hook for greater liability in the catastrophic layer, in that we get less reinsurance than what we used to, and so we intend to price for that and be very thoughtful around that. Now, to add to that, their executive vice president and chief financial officer, he said there is a very substantial change in liability there, which will result in much higher premiums, which we think is going to impact overall benefits within the bids. Now, at WellCare, their executive vice president and chief financial officer had similar thoughts to Aetna during their earnings call, and they said that is why there's reason for cautiousness for the industry in bidding PDP in 2025. Just know in this context, PDP is Prescription Drug Plan, or Part D. Essentially, these executives at these massive Part D insurance companies, they are signaling that you, the consumer, should expect increases to your Part D premium in 2025 due to the changes that we have mentioned so far. How much these premiums will increase is anyone's guess, but with that being said, we will talk about our thoughts heading into next year right now. First, some of these changes to the Part D system, they are needed, and we are happy to see that some of our clients with extremely high prescription drug costs will almost certainly benefit in 2025. For far too long, we have seen people personally struggle to afford costs of life-saving medications, and now, with lower cost potential, we hope that those same people with high-cost prescriptions will be able to take them without skimping on or missing doses, so they can improve their overall health without financial devastation. With that being said, if you're watching this video and you are like many of our other clients who take no medications or low-cost medications, you will almost certainly be negatively impacted in 2025 by these higher premiums for prescription coverage that you feel you probably are hardly using in the first place. Also, before you see videos or articles saying you don't have to worry about rising Part D premiums because the Inflation Reduction Act capped premium increases to no more than 6% per year, just know that is not the case. Instead, it is an unfortunate misinterpretation of the rule that is tricking people into thinking that they are safe from high premium increases. Instead, that 6% premium increase cap, it applies to the Part D base beneficiary premium, not individual plan premiums that you actually pay out of pocket. The way the base beneficiary premium is calculated is by using a pretty complicated method, and it's really frankly not worth knowing. But what you should know is that the base beneficiary premium, it's used to calculate the Part D penalty. So in 2024, the base beneficiary premium is $34.70 per month, and that can't increase to more than $36.78 per month in 2025. So unless you're getting that Part D penalty, this 6% cap on increases really won't impact you directly. You can even see here that MedPAC states that individual plan premiums can increase by more or less than 6%, probably more in this case. Also, instead of increasing premiums for low-cost plans that may currently be offered by a company, Part D plans, they may simply remove current plans from their market and automatically change people currently enrolled in those plans to more expensive plans through a process known as crosswalking. Crosswalking is not uncommon in normal years, and we only see this becoming more common going into 2025. Also, insurance companies, they often offer up to 3 different Part D plans in a market. So once a company offers a basic plan in an area, it can offer 2 additional Part D plans that are enhanced in that same area. In 2022, these enhanced plans had an additional additional $9.9 billion in premiums, which again are unrelated to that base beneficiary premium that we talked about. This is also seen by the fact that despite the base beneficiary premium in 2024 being $34.70, CMS reported that the average Part D premium is actually $55.50 per month. Now, we could sit here all day and say that Part D premiums will skyrocket due to plans having more financial responsibility in the catastrophic phase of coverage, all while they have to navigate a new payment plan and additional changes. But really, that doesn't help anybody, and it does ignore some important details that you should know. First, Part D plans, they're not on their own when it comes to overall cost and spending. We say this because Medicare pays two different subsidies to insurance companies that are designed to cover 74.5% of the standard coverage for Part D beneficiaries. These subsidies are the direct subsidy, which is a set payment to Part D plans from the government, and the other subsidy is in the form of reinsurance payments. This is designed to reimburse insurance companies for the cost that Medicare pays for enrollees that reach that final catastrophic phase of Part D coverage. Although the official Medicare Board of Trustees report projects the reinsurance subsidy to drop all the way from $67.3 billion in 2024 down to $25.5 billion in 2025, the direct subsidy we talked about is projected to increase substantially from $19.5 billion in 2024 up to $81.4 billion in 2025. So while it is true that reinsurance payments are dropping, like companies are talking about in their earnings call, the increase in direct subsidies will help absorb at least some of this impact. Now, we don't think it will be enough, but it's something. This was even highlighted by the CFO of WellCare during their earnings call, as you can see here by what he said. It's important to point out these subsidies since Part D plans, they are not just responsible for 3 times as much in the catastrophic phase without some increased financial backing. Also, despite the fact that Part D plans are responsible for more and seemingly unlimited cost in the catastrophic phase of coverage, just know that if these plans bid incorrectly and their costs end up being much higher than expected, they do have some financial protections in the form of what are called risk corridors. Now, this is far too complicated to get into this video, and frankly, I don't truly understand this whole mechanism, but we will link to this document for more details below. All this is to say, we are still in agreement with most people who believe that Part D premiums will increase across the board, but we really don't think it's as drastic as some want to scare you into believing. Right now, in 2024, the average Part D premium again is $55.50 per month, but this only shows a small piece of the overall puzzle since weighted premiums for Part D plans in 2024 are actually closer to $48 per month as reported by KFF. This is just a fancy way of saying more people are enrolled in plans lower than the reported average. So, while we do think that the average Part D premiums could increase by $20 to $40 per month or more in 2025, we don't think you will be forced to only choose from Part D plans with premiums at $70 or more per month. This is simply speculation on our part, but we do think there will still be plans that want to compete for people with lower cost medications. These plans, they might not be right for everybody, but they may still provide lower cost Part D options for individuals with lower prescription needs. After all, companies like WellCare, they currently have 6.4 million Part D members. Aetna has 5 million and United Healthcare has 3 million. These companies won't willingly lose all of these members if they can avoid it. Besides increasing premiums, Part D plans, they may also try to implement additional cost-cutting measures. For example, they might reduce the number of medications covered by their formulary. They may shift the tiers of their medications, so one that was tier 3 might be tier 4 or vice versa, and they might add added utilization techniques like step therapy and prior authorization to limit the use of high-cost medications. Or simply, they might stop offering Part D plans altogether in the most drastic scenarios. So what can you do right now? Aside from watching this video, really, the answer is nothing. Whatever changes are going to happen with Part D, they're going to happen. Knowing that change is coming is most of the battle in this case, so if you have anybody else in your life who needs to know about these upcoming Part D changes, please make sure to share this video with them. Going forward, the most important thing you can do is keep an eye out for your annual notice of change that will be mailed to you by your current Part D plan by the end of September. This document will highlight important changes you need to know, especially your changing Part D monthly premium. Once you have that information and all the plans release their details to the public on October 1st, make sure you tune into our channel where we will publish a video showing you how to compare Part D plans in depth for 2025 using Medicare.gov. So for now, make sure to subscribe and follow us for more videos until then.